Good morning, everybody. So it is good news. We only have one further case. And just to say that there have been now quite a number of people test positive who have been at either the Creek on Halifax or the Tenafeate winery. So they're obviously our high transmission sites. We do expect, therefore, to have some more positives coming through. But the important thing, if those people have been in quarantine for the entirety of that period of time, they will not have had any exposure sites, and that means we're still safe. So just to let people know that it's not just about the numbers, it's also about the fact that these people have been in quarantine. So indeed, this is a new case, again linked to the Tenafeate Creek wines, and it's a male in his 60s. That means that we've now got 9 cases linked to that winery. Now, this gentleman also visited the winery with his wife, and his wife is a case, and they were residing together in Tom's Court. Now, just to make it perfectly clear that our team, and this is a team of very experienced clinical staff and nursing staff, we always need to look at the well-being and the health of all individuals, and everybody's in a different circumstance. And so the nursing staff do, generally we like to have people separated, obviously if we don't have somebody positive, but we always ask individuals whether they would like to be with somebody if it's required from a care and mental health and a wellbeing perspective. This gentleman is stable and he's in Tom's Court, and his wife is also stable. Now, we have just had one further transfer to the Royal Adelaide Hospital. We do unfortunately have another older person, so a woman in her 80s, and she needed to be transferred to the Royal Adelaide Hospital last night, and along with the other gentleman in his 80s. Now, I'm really pleased to be able to tell you that both of those people, despite their age, are stable, both requiring a small amount of oxygen, but the staff are very happy with their clinical status. And then just in addition to that, one of our younger cases, one of the younger people in their 20s needed to have a review at the Royal Adelaide Hospital, so they had a clinical review there yesterday, but fortunately they were deemed to be quite stable and have gone back to Tom's Court. Now, I know that everybody has found that lockdown can be quite stressful, but just to point out to people that when you're actually a case and you're in Tom's Court, it's really, really stressful. So I do thank everybody for the work that they've done, and also please, South Australians, give a bit of a thought to those people in Tom's Court. We've also got a significant number of people in quarantine, either in that Tier 1 or Tier 2 category. Some people are in our Medi hotels because of circumstances, but there's a large number of people that are quarantining at home. And the way that we are now working in terms of our contact tracing, a lot of it's automated by sending SMSs. And of course, if we had the capacity to ring all 5,000 people as soon as on the first day and make personal contact, that would be good. But we simply don't have the staff to do that. But please follow the SMS, and we're working through all of the different tiers to make sure that we are in contact with the majority of people. It's just really important that we have you remaining in quarantine for the entirety of the 14 days, unless you're contacted by SA Health, and it's said that you can come out earlier depending on a risk assessment. So from the perspective of the Creek on Halifax in the winery, I'm pretty confident that we've managed to contact everybody now, and my team are working through all of the negative tests, and I think there's only one that I haven't been told about, so I'm very pleased because that's our major risk here in South Australia. One of the other risks is some of the other exposure sites. So, and I've asked the team to go back systematically today, and we're doing a lot of collation to look at all of the exposure sites right back from last week and the week before. There's a couple of new exposure sites. So this gentleman who tested positive yesterday, very pleasing. He did have a negative result earlier in the week, but my team have confirmed that he did have some symptoms on Monday before he went into quarantine. And so out of are absolutely being very precautious here. We have called out a couple of exposure sites for that Monday, and those are at Clovercrest, a shopping centre. I believe one of them is a bakery. So it's important to go and have a look at that up on the website. Now, also just to say, and I know this can be a little bit frustrating, but it's because we're constantly monitoring, constantly refining our risk assessment as we get more information from people. And sometimes the times change. And also where we've got Tier 1 and Tier 2, we do sometimes make some changes to that. So it is important that you keep monitoring that probably 3 times a day. Our staff are trying to make sure that we update it as quickly as we possibly can as we get new information through. And that's because it is an evolving situation, and it's because we're getting more information. It's not because the original information was wrong, it's just that we get more detailed information, including in many cases CCTV footage. So the teams are doing a lot of background work behind the scenes, trying to get this as tidy and as closed up as quickly as possible. In terms of our testing, the Premier has also said that this morning. Absolutely fantastic to have those tests done. I'm very pleased that there are not the long queues. I also wanted to add, as well as ACL and ClinPath as private pathology providers, Abbott Pathology may be also providing COVID testing in South Australia, and I'm actually looking forward to having a meeting with all of our pathology providers today. And it's really important in a state that when you've got more than one pathology provider, that we're all working together, and I'm looking forward to doing that. In terms of the people who have currently been identified to have been at an exposure site, there's about 18,000 people now. Now, not all of those are in quarantine because they may be at a Tier 3 or a Tier 4 site, but just to give you some idea of the impact of even a relatively small number of cases, 16 cases in a population, and it gives you a bit of a sense when you look at what's happening in New South Wales, when each of us come into contact with many, many people during the day, and we visit many sites during the day. So I'm very happy to take questions, but that's where we're up to for now in SA.
That man Scramley, the new case, told us yesterday he had no symptoms at all and did not request to go into Tom's court with his wife. What do you say to that?
Look, all I can go by is my clinical team, and obviously we don't go into details of conversations that we've had with our patients, and we won't be in this situation either.
So can you tell us then, so is this the policy that spouses are put into the same hotel together? And if that's the case, of the other people who were infected at the winery, how many of them were moved into Tom's court with their spouse who was not infected?
So as I said before, our policy is to, if we have a person who may need some additional care, our policy, and that could be somebody who's a minor and we need to have a carer with them. It could be an older person who has some frailty and needs some additional care. And it can be people with, indeed, who have some mental health issues. And in all of those situations, we ask, is anybody able to assist with that and go into care with that person? So we would, there's many instances here where we've got a husband and wife who have been separated, but my team work with the individual